Thank you, President. My matter is addressed to the Minister for Mental Health. This Saturday marks International Overdose Awareness Day, a day of action to raise awareness of this worldwide public health crisis and to advocate for overdose prevention. I want to acknowledge the Pennington Institute for convening this global event and for their continued advocacy for sensible and humane drug laws. Pennington have also released Australia's annual overdose report for 2024 to coincide with the day. It has some sobering statistics. Overdose deaths continue to increase, and each year we set a new record for the number of drug-induced deaths. This grim record is largely driven by opioids, including dangerous novel synthetic opioids like nitazene, which now account for 69% of overdose deaths internationally. In 2022, we recorded 2,356 overdose deaths in Australia, 80% of which were unintentional. And since 2008, overdose deaths have exceeded the road toll, and not by some small margin. Around 40% more people die each year from unintentional drug overdose than are killed on our roads. Both are tragic. But we spend millions every year on reducing our road toll. Where is the bold strategy to set Victoria on a path to zero overdose deaths by 2050? Because it doesn't have to be inevitable that our drug overdose toll continues to rise. The Pennington report calls for a comprehensive overdose prevention strategy, one which includes education, ready access to naloxone, more overdose prevention sites, better access to treatment and more drug checking, not just at festivals, but in the community. We warmly welcome the government's announcement of a drug checking trial and its plans to roll out naloxone dispensing units in the community, but we need to do more. The theme of this year's campaign is Together We Can. It encourages us to stand in solidarity with those affected by the tragedy of overdose and to acknowledge the intense grief felt by those who have lost a loved one. Overdose deaths are preventable. We can and we should be doing more to avoid this preventable tragedy. And so the action I seek is for the Minister to develop a comprehensive overdose prevention plan as part of the state's AOD strategy.